Now, the Sickle Cell Association at the SDA hospital in Sunyani has stated that with the increase in cases of sickle cell disease among babies, couples must get tested to know their sickle cell status before they give birth to help reduce giving birth to children with that condition.
The SDA hospital, in its quest to support people living with sickle cell disease in the Bono region, is providing education and counseling services for persons with such a challenge. City News' Michael Saponfum has more.
Sickle cell disease is an inherited blood disorder. It interferes with the delivery of oxygen to the tissues, resulting in pains in the body. Sickle cell disease is a major genetic disease that affects most countries in the African region. In Ghana, it is estimated that 15,000 babies are born yearly with sickle cell disease. People with sickle cell disease often feel weak, tired, and look pale. Environmental factors often play a role in the occurrence of painful attacks. Common triggers include cold temperatures, dehydration, among others. A 62-year-old retired prison officer, Isaac Bamfujechi, tells City News how he has been living with sickle cell disease.
The secret is that it is discipline and how you take your drugs. By the grace of God, I'm 62 years. I've been a prison officer for the past 35 years, and I've been working with the inmates and then officers, and all along, sometimes I use my own life as experience to some of the inmates, because some of the inmates, when they come, we are able to know that they are also in the same group like my own. So I also advise them. Some of the officers advise some of the inmates, so that they also take their drugs seriously, especially the folic acid.
The SDA hospital in Sunyani, on its part, is helping people living with sickle cell disease through education and counseling services to enable them live a normal life.
In SDA hospital, in 2017, we started organizing women, children, people with sickle cell condition when they come to the hospital. Last year, 2020, we launched Sickle Cell Association in the hospital. And since the day we launched Sickle Cell Association, it has been improving from 19th June 2020 up to now. Our number has increased. We started with about 40 people. Last year we had about 150, and now we are almost 250. We have those who are active, and we have those who are dormant. Even though they call to get information from us, because of distance and their work, they don't normally come for meetings, but they are always with us and they get information from us.
Some persons living with sickle cell disease and have benefited from the services provided by the SDA hospital have been sharing their experiences.
When we used to go to the hospital, doctors used to advise us on what we have to do and what we don't have to do. By joining this association has really helped us enough. Like, we do know that we have to take our folic acid daily and other stuff. By joining this association, especially being introduced to the drug called hydroxyurea, has really helped me.
Before joining the association, I encountered a series of crises. I could go a whole year with 3 or 4 crises. And when these crises come, it would result in blood transfusions. So after joining the association, I could go a whole year without even crisis. I could even go a whole year without being admitted in the hospital. And I was being led away from the blood transfusions and all those complications I had to face before I had joined the association.
Angelina Amwatima is advocating for couples to get tested for sickle cell disease before giving birth.
Nowadays, the maternal mortality is now on non-communicable diseases, which sickle cell is one of the dominant one. And so our target is on the pregnant women. And so we give them education. And we have a special clinic for pregnant sickle cell women. We are now advocating that couples or people who want to give birth, that is the time you have to come and screen yourself. We screen you to see if you have a sickle cell or not. Because it's out of 10 people, we can get 2 babies who are sickle cell patients.
From the SDA hospital in Sunyani, I am Michael Saponifum For City News.